Hello, I'm Dr. Dennis McKenna, joined again today by Dr. Venditti. Today is Monday, March 23rd. We were here all weekend.
We were.
And we're here back again on Monday morning to give you the update from Albany Medical Center on the coronavirus. Our outfits have changed a little bit, Fred.
They have. Our facilities folks wear these outfits, and we thought we would wear these jackets for today to recognize the hard work that they're doing during this crisis.
Absolutely. This morning, Albany County has reported there are 123 people in Albany County that have tested positive for COVID-19. As predicted, that number has gone up as we've increased the amount of testing out in the community. Inside Albany Medical Center, that's translated into 11 patients that we've treated here. 4 have been discharged. There's currently still 7 in the hospital. We have 4 of them on a medical floor, and we have 3 of them in what we call a step down or in an ICU setting. We currently have an adequate number of beds, ICU beds, ventilators, and staff to care for all those patients. How are we on PPE?
I would add that our PPE supplies are very adequate. Again, the supply folks have just done a tremendous job identifying new sources for us. And remember, Dennis, we've talked about this before. We began looking for new sources of PPE more than 2 months ago. So we've identified those new sources. We've gotten stockpiles. We have plenty of everything for our staff to safely take care of patients.
That's great. When we talked to the area hospitals this morning, as we do every day, including this weekend, among the 11 hospitals that we've spoken to, there's a total of 20 patients currently admitted to the hospital. So that's an update for the region. Let's go back again on this campus. We've converted our testing tent over to an evaluation tent. That was fully operational yesterday. We saw 41 people in that evaluation tent. Again, that's intended to be for people who want to be checked out. We are only testing for COVID-19 symptomatic healthcare workers because it is essential. It is essential that our workforce not work sick, must not come in sick, shall not come in sick. So temperature greater than 100, a persistent cough, or unexplained shortness of breath. We are testing symptomatic healthcare workers or members that are first responders. Another bit of good news is we've increased the hours of our employee health service now. We're open from 7 a.m. to 7 p.m. 7 days a week. So we think that'll give our workforce a chance to come in and be evaluated if they're not feeling well. And again, we want to emphasize they're not working sick. We're going to have thermometers at various locations in the hospital.
That's right. Tomorrow we're going to start rolling that out where people will be able to take their temperature, or we'll take your temperature as you either enter the facility or show up for work on your unit. I can't emphasize enough how important it is. Please do not come to work sick. It's a professional responsibility that we all have to not do that. Put those patients first. Please don't come to work sick.
Agree. Put a plug in for tomorrow. There's going to be a virtual town hall that Fran Alpert, Darlene Souza, George Hickman, and John DePaula will do. It will address a myriad of HR issues. They'll be answering questions that they've received, and that will be posted online, so we look forward to that.
That'd be good.
Fred, update on our surge plan. I know there's a lot of questions about, are we prepared for more patients?
I think the short answer is we are prepared. So you heard on Friday that the commissioner asked us to submit our plan. We are well along in the development of that plan even before the commissioner asked for it. Let me cover 5 elements that are in the plan that the Department of Health wants to see. The first is they want a plan for us to increase our capacity by 50%. Now that might sound a lot, but we have very creatively looked at space throughout the hospital, and I'm quite confident that we will be able to do that if the surge actually happens. We've also developed a staffing plan, both nursing, physician, and other important workers within our organization to care for all those patients should we have to ramp up in that fashion. We've got triage plans, both in the ED and elsewhere for patients in the house, and we've done this in a graded fashion. So we've actually got a plan that's 5 tiers. So tier 1 would be the first step we would take as we began to see a surge, all the way through tier 5, which would be the worst possibility in terms of the volume of patients coming at us. I'm very confident that we can handle anything that happens.
Great. So it sounds like a very well thought out plan and ready to scale up as we go.
Absolutely.
Very good. Any questions for me?
Yeah, Dennis, talk to us about working from home.
As we talked about last week, we are working very hard to take members of our workforce who don't need to be on this campus and give them a chance to do that same work but do it from home. Today, compared to a week ago, we now have 100 extra people who are working from home who weren't a week ago working from home. However, stay tuned. By the end of the week, I think we're going to report out a number that's significantly higher than that, which will allow us to continue to do the essential work we do here, but do it at a different location for many members of our workforce.
That's fantastic.
Great. Okay. So that's our update for today. Once again, we thank all of you who are caring for the COVID-19 population and all the other patients here at the Medical Center. We ask you to take care of yourself, take care of each other. We'll see you tomorrow.